The year 2024 brought with it a familiar threat: avian influenza. A highly pathogenic strain of H5N1 swept across the United States, infecting wild birds and commercial poultry. The outbreak raised concerns about human transmission and economic impact. Health officials and scientists raced to control its spread and mitigate effects. This outbreak underscores the interconnectedness of human, animal, and environmental health. H5N1 is a subtype of the influenza A virus, commonly known as bird flu. This virus primarily affects birds, and different strains vary in their ability to cause disease. The strain involved in the 2024 outbreak is highly pathogenic, meaning it can cause severe illness and death in poultry, often with mortality rates approaching 100%. The virus spreads through saliva, nasal secretions, and feces of infected birds. Wild birds, particularly waterfowl, can carry the virus without showing symptoms, acting as reservoirs and spreading it during their migrations. In poultry, H5N1 infection can manifest in various ways, from mild respiratory symptoms to sudden death. Infected birds may exhibit lethargy, loss of appetite, decreased egg production, and swelling of the head, eyelids, and comb. The virus can spread rapidly through flocks, especially in intensive farming settings. This poses a significant threat to the poultry industry, as containment often requires culling entire flocks to prevent further spread. The 2024 bird flu outbreak first emerged in the eastern United States, with initial cases detected in wild bird populations along the Atlantic coast. The virus quickly spread westward, facilitated by the migratory patterns of wild birds. As the outbreak progressed, cases were reported in commercial poultry farms across multiple states, leading to significant economic losses for farmers and disruptions in the poultry supply chain. The rapid spread of the virus highlighted the challenges of containing highly contagious diseases in an interconnected world. The outbreak's impact was felt across various sectors of the poultry industry, from small backyard flocks to large commercial operations. The virus affected chickens, turkeys, ducks, and geese, underscoring the wide range of bird species susceptible to H5N1 infection. As the outbreak intensified, state and federal agencies implemented strict biosecurity measures, movement restrictions, and surveillance programs to track the virus's spread and mitigate its impact on the agricultural industry. While H5N1 primarily affects birds, it can occasionally jump the species barrier and infect humans. Human infections are rare but can be severe, often leading to respiratory illness, pneumonia, and even death. Most human cases of H5N1 infection have been linked to close contact with infected birds or contaminated environments. However, the 2024 outbreak raised concerns about the virus's potential to mutate and become more easily transmissible between humans. The primary route of transmission from birds to humans is through direct contact with infected birds, their saliva, feces, or contaminated surfaces. This includes handling live or dead birds, touching contaminated cages or equipment, and inhaling droplets containing the virus. While human-to-human transmission of H5N1 is rare, it is not impossible. The 2024 outbreak highlighted the importance of monitoring for any signs of sustained human-to-human transmission, which could signal a potential pandemic threat. Section 5. Missouri's unique case, a cause for concern. In the midst of the 2024 bird flu outbreak, a case in Missouri raised particular concern among health officials. A poultry farm worker tested positive for H5N1, marking the first known case of human infection in the United States during this outbreak. The individual's close contact with infected birds was identified as the likely source of infection, and thankfully, they experienced only mild symptoms and recovered fully. While this isolated case did not indicate sustained human-to-human transmission, it served as a stark reminder of the potential for spillover events. The Missouri case highlighted the importance of robust surveillance systems, rapid response mechanisms, and clear communication channels between public health and agricultural sectors. It also emphasized the need for continued research into antiviral treatments and vaccine development to mitigate the threat of future outbreaks and potential pandemics. Section 6. Economic fallout, the impact on poultry and dairy. The 2024 bird flu outbreak sent shockwaves through the agricultural industry, leading to significant economic losses. The culling of millions of birds to control the virus's spread resulted in a decline in egg and poultry meat production. This, in turn, led to price hikes for consumers and disruptions in the food supply chain. The outbreak's impact extended beyond poultry farming, affecting related industries such as feed production and transportation. The dairy industry also experienced indirect consequences. The outbreak led to an increase in the cost of animal feed, which relies heavily on corn and soybeans. These crops were also in high demand for ethanol production, further driving up prices. This placed additional financial strain on dairy farmers, already grappling with rising input costs and fluctuating milk prices. The interconnected nature of the agricultural industry meant that the economic fallout from the outbreak was felt across multiple sectors. Section 7. The USDA's response. Containing the spread. The United States Department of Agriculture, or USDA, played a crucial role in responding to the 2024 bird flu outbreak. The agency implemented a multi-pronged approach, focusing on surveillance, early detection, rapid response, and containment. The USDA worked closely with state and local authorities, as well as industry stakeholders, to track the virus's spread, implement quarantine measures, and minimize its impact on the agricultural industry. One of the USDA's primary responsibilities was to control the movement of poultry and poultry products. This involved establishing quarantines in affected areas, restricting the transportation of birds and eggs, and intensifying inspections at poultry farms and processing facilities. The USDA also provided guidance to farmers on biosecurity measures to prevent the introduction and spread of the virus within their flocks. These measures included controlling